Welcome back to the Atlanta Fibroid Center YouTube channel. One topic I wanted to mention is a scenario that we see relatively commonly in the office. A patient will come to us believing that she has fibroids based on an ultrasound exam in the gynecologist's office, and we routinely obtain an MRI exam which shows to greater detail what's going on in the uterus. And so while the patient will have the diagnosis of fibroids, when we see the MRI images, it will be adenomyosis instead of fibroids, or sometimes they may coexist. And so that is a particularly challenging dilemma to explain to the patient that perhaps they don't have fibroids at all. And so while the symptoms are very similar between fibroids and adenomyosis, namely heavy periods and pelvic pain, in general, patients that are suffering with adenomyosis, the pain is more significant than the bleeding. And for fibroid patients, typically the bleeding is more significant than the pain, but there's obviously a lot of overlap. And so from time to time, we'll see patients that believe they have fibroids when in fact, when we do the MRI, they have adenomyosis. Now, in the past, before there was uterine artery embolization to treat these two conditions, it was really an academic point and the gynecologist didn't really care. If the patient went to hysterectomy and they believed it was for fibroids, and when the uterus was removed and went to the pathology department and the pathology department said, well, you know, doctor, this was adenomyosis, the gynecologist really didn't care because it didn't matter if it was one benign condition, fibroids, or another benign condition, adenomyosis. It didn't matter. But now it makes a big difference because sometimes patients will undergo myomectomy surgery for what was presumed to be fibroids is actually adenomyosis, and that is a very significant problem. So when surgically you go in for fibroids, it's called a myomectomy, and if the patient doesn't have fibroids and has adenomyosis, that cannot be removed surgically. And so there is an obvious problem here. Either the patient has to be woken up and told that they misdiagnosed and there is nothing to take out, there aren't any fibroids, the uterus is enlarged, but it's due to something else, this adenomyosis, or the patient ends up with a hysterectomy. And obviously that is tragic. Uterine artery embolization can treat both conditions. And so it's very important to make the diagnosis correctly, and that requires an MRI. Ultrasound is not adequate to diagnose adenomyosis accurately. As I said, a lot of patients believe they have the diagnosis of fibroids only to find out that they have adenomyosis by MRI. Fortunately, we can treat both conditions non-surgically with embolization. Now, the success for fibroids is a little bit higher than adenomyosis. In our hands, over 90% of patients get the significant relief of symptoms they're looking for if it's for fibroids, and it's more like 80% for adenomyosis. And as I mentioned, some patients will have both. And so it's really important to obtain the MRI to make an accurate diagnosis and then counsel the patient on her treatment options, whether it is surgical or whether it's embolization.